We did also look before about how the cones are not evenly distributed, right? There are many, many more red and green ones than there are blue ones. Remember we were talking about that? And we said that most of your color vision is based just upon the ratio between the red and the green, and the blue is just there to give you a little bit of sort of sensitivity to blue, but you don't really have high resolution in the blue channel. If you were to take a look in your eye, well, not your eye, because this has to be a dead eye, so some other eye, or your eye after you're dead. If you want to donate your eye when you're done, just send Megan a postcard. If you peeled the retina out and you stick it under electron micrograph, if you take a look at that, you'd see that as you moved along the eye, it was not the same everywhere. In the middle, which is the area referred to as the fovea, about 1.5 degrees, you see this magnificent hexagonal packing of photoreceptors. Okay, so hexagonal pack, so if you will, the pixels in the human eye are not on square grid, but they are on a grid. They're on a hexagonally packed grid. And the regularity of this is pretty remarkable, right? I mean, it gives you a very good sampling, a very dense and regular sampling of the underlying visual field, which is one of the reasons that you have such good high resolution up here and really lousy resolution out here. You see, so I'm looking straight at Megan. Wake up. Okay, good. So I'm looking at, I can't really tell how many fingers I'm holding up. I mean, I happen to know, of course, because they're my fingers, so I can tell there's 7 of them, but, or whatever. But I can't, if you do that yourself, just do it this way. If you want to have a partner, look them straight in the eye and have them bring their fingers in. And you'll see the fingers are there. You can have them wiggle them. But if they ask you how many fingers are they holding up, you can't really tell till it gets pretty close. And yet you feel like you've got all this high resolution vision out here. That's an illusion that your brain is creating for you. Out here in your periphery, you just have good sensitivity to motion. In fact, wiggle your fingers, you'll see them right away. Why might you want to do that? Well, maybe you want to saccade your eyes over there. So the system is very good at detecting motion in the periphery and controlling the eye to look at it and foveating on what's there. But you actually only have high resolution in this very small area. In the periphery, as shown here, you have a few large cones. So the cones are actually big, and they're giving you overall color information. And then you have this high density, again, of rods. So with low levels of illumination, you can still see out really well. There, let's take a look at this picture. So this picture is degrees from center. So temporal is off to the side, nasal is towards the nose. And the first thing you'll see is that you've got all these cones that are mostly in the middle, in the fovea. That's exactly what we said. Notice, the same way we have rods out here in the periphery, notice you don't have any rods in your fovea. Oh, here's your blind spot, right? You don't have anything there. That's why it's blind. So what would one of the implications be of having no rods in your fovea? It would mean that you don't have very good low light perception in your fovea. And here's another experiment you can do. Some night, go outside when there's a bunch of stars, some that are really bright, some that are less bright. See if you can find a star that's less bright that stays there till you look at it. And when you look at it directly, it disappears. And that's because your fovea can't see the low light that your rods do.